Submerged in the murky water of a deep, dirty trench, soldiers trudge through the mud as rain soaks their uniforms. Their hair is matted and their faces are dirty. Grimy rats swim across the water as lightning cracks and sends exhausted men to duck and cling to the high dirt walls for fear of more shelling. They realize it is only a storm, and with empty eyes they continue waiting, exhausted in paranoia, fear, and constant shock. The rising number of shell-shock victims during World War I caused scattered reactions from within the military and medical fields. The increasing amount of permanent ineffectives during the war prompted reform in the medical industry and called for more effective ways of treatment. New treatments such as psychotherapy were put into place and revolutionized psychiatry, forever changing the way we look at trauma. It is the early 20th century. Europe is consumed by the First World War. Young men join the army with eager hearts, encouraged by patriotic and popular songs. They believe they can simply pack up their troubles, achieve glory, and see the world by joining the military. They find the battlefield is nothing like they expected, and many suffer from severe mental and physical exhaustion. On the Western Front, soldiers are crowded into trenches across a 500-mile-long system of fortifications. They are constantly engaged in a deadly combination of old tactics and new weapons. Enemy attacks are unpredictable, and artillery blasts are constant. In the First Battle of the Somme alone, there are over 500,000 casualties. At the Battle of Verdun, an estimated 700,000 men are killed or wounded. Poison gas was first used at the Second Battle of Ypres when the German army dispersed a cloud of chlorine gas toward their enemies. The French soldiers gasped for breath as this horrifying new weapon destroyed their respiratory systems. The unprecedented slaughter takes many of the surviving soldiers to the brink of madness. Artists who were exposed to the frightening scenes of war use their abilities to portray their trauma through various forms of expression. Otto Dix, a German soldier and printmaker, expressed the haunting images of his mind through vivid, gory, and disturbing works. The symptoms of shell shock spanned from mild to extreme and were experienced in two separate stages. There were those who suffered from Wave 1, which occurred directly on the battlefield. It was also known as war hysteria. Soldiers who experienced Wave 1 also endured Wave 2, now known as post-traumatic stress disorder. However, many soldiers were afflicted with the second wave and never the first. These men were able to stay composed during battle, yet suffered from repressed emotions and memories after the war. Speech disorders and mutism were the most common symptoms of war hysteria. Many soldiers suffered from intense nightmares, known as night sweats, because of their typical side effects that included an increased heart rate, enhanced adrenaline, and heightened perspiration. Siegfried Sassoon was a French officer treated at Craig Lockhart Shell-Shock Hospital near Edinburgh, Scotland. He had performed a daring act in the face of fear as he single-handedly charged a trench of German soldiers with a grenade in each of his hands. The Germans retreated from their post and Sassoon was treated as a hero. In 1917, he was diagnosed with shell-shock and sent to Craig Lockhart. During his stay there, Sassoon recalled one of his terrifying night sweats in a detailed description. When the lights are out and the ward is half shadow and half glowing firelight, then the horrors come creeping across the floor. A livid, grinning face with bristly mustache peers at me over the edge of my bed, the hands clutching at my sheets. There is a hole in his jaw, and the blood spreads across his face like the ink spilled on blotting paper. Despite the obvious terror Sassoon and others suffered during these common bouts with nightmares, these symptoms were considered mild. The most shocking and rare symptom of shell shock was hysterical paralysis. A soldier suffering from the symptom would often lose control over one or more parts of his body. For instance, his legs would not walk properly, or he may become blind or only react to sounds and words related to war such as bomb, all with no physical explanations. Those who showed symptoms of shell shock were commonly viewed as cowards who were trying to escape the war and were oftentimes executed. If they did not meet this horrible fate, soldiers were taken to medical facilities to receive treatment. By 1916, over 40% of British fighting zone casualties were victims of shell shock. By the end of the war, over 80,000 shell shock casualties had passed through British medical facilities. By 1918, there were 20 such hospitals in the UK for treating mental illness and shell shock. Although shell shock did not discriminate, the rate of hysteria was 4 times higher among officers compared to regular soldiers because it was necessary for them to appear as fearless and masculine leaders. The overall goal of treatment was to help soldiers recover well enough to return to the battlefield. Therefore, quick physical methods were preferred by doctors, and many were skeptical of any other way, and common treatment for mental illness in the early 20th century was undeniably harsh and often contradictory to recovery. Men who feared isolation were put into isolated rooms. Those who feared extensive amounts of noise would be placed in a room near the road. Medical officers disciplined patients for their so-called defiant actions and shamed them for their afflictions. They were put into progressive re-education programs that were in part seen as a feminine solution. A popular method for treating mental disorders was electric shock. A current would be sent through the back or legs of a man who could not walk, or through the throat of one who could not talk. One form of re-education was seen at the Steelhain farm, where men would gradually relearn to do everyday tasks. Their activities included sewing, weaving baskets, farming, and digging. Eventually, they would be taught to load guns again, and some could rejoin the military. However, 4/5 of men treated for shell shock were never able to return to the battlefield. Craig Lockhart Hospital was one of the most famous shell shock hospitals in the UK. During its time in operation, 1,736 patients were treated for shell shock there. While it was known for harsh physical treatments, it was also one of the few to try something different. Shell shock was originally believed to be a strictly physical affliction. Over time, doctors learned this was not the case. They were seeing cases of shell shock in which the victims had neither come under fire nor had they ever been in range of shelling and blasts. This suggested that they were overcome by the mere thought of warfare. William Rivers, a neurologist and doctor at Craig Lockhart, developed and practiced some form of psychotherapy to use on his patients. Methods of psychotherapy were very costly and intense. Siegfried Sassoon was his most famous patient. Each day they would meet to have a session in which Sassoon would discuss his disturbing war experience. Sassoon's mental health gradually increased, and he was released after only 4 months. Another patient by the name of Wilfred Owen stated that his night sweats had transitioned away from gruesome battlefield disasters and took on a more civilian appearance as he dreamt of car accidents rather than war. The majority of doctors refused to use any form of psychotherapy as they believed it did too little and took too long. Although this method was rarely used in World War I, some officers who received proper psychiatric treatment found that they were able to return to the battlefield with a steadier mind. They were able to better understand the trauma they had previously suffered. The use of psychotherapy allowed those with PTSD to recover with better results than with traditional physical methods. Only a generation later, in World War II, a condition emerged that doctors called war neurosis. Soldiers who were affected suffered from symptoms similar to that of shell shock. As they scrambled to find an answer, the medical field seemed to have forgotten about shell shock. The cycle began again. However, psychiatry had become more advanced, and the need for psychotherapists escalated. There was a shortage across the nation. Later in the 20th century, the Vietnam War took a toll on soldiers due to its violent and unpredictable nature. Trauma took center stage yet again as men and women returned home and began noticing changes in themselves and other veterans. They experienced irritability, nightmares, and other symptoms similar to those of shell shock and war neurosis. In the mid-1970s, the term PTSD, or post-traumatic stress disorder, was coined, and finally, there was a diagnosis. After the war, the stigma that once weighed so heavily upon the shoulders of the afflicted was greatly lessened. In 1983, the National Vietnam Veterans Readjustment Study was conducted by the U.S. government. It was found that among Vietnam veterans, 30% of men and 20% of women had PTSD at some point following the war. Veterans began to realize that they were not alone in their trials, and many sought psychiatric help after living with their symptoms for months, years, or even decades. The mysteries of trauma were finally beginning to be understood and accepted in society, and the broken minds of soldiers could now be mended. The impairment is much more accepted in modern times. Psychotherapy methods are now used widely in practice to treat PTSD victims. Today, studies have shown that 15 to 20% of current returning veterans suffer from PTSD. Over 200,000 Iraq and Afghanistan veterans have been treated for PTSD by the Department of Veterans Affairs alone. The widespread use of psychotherapy isn't restricted to traumatized soldiers. Psychotherapy is widely used and effective in civilian counseling as well. The vast majority of licensed therapists today integrate elements of psychotherapy into their general practices. Professionals have learned that PTSD can be caused by a multitude of traumatic events, such as abuse, natural disasters, personal loss, and being a victim of violent crime. The introduction of a new treatment of shell shock in the early 20th century offered hope. The struggles that those men faced in dealing with the devastating realities of war and trauma laid the foundation for a more promising future. Because of the integration of psychotherapy in the treatment of those shattered men during the First World War, our understanding of the effect of trauma on the human mind has greatly increased. To save these men, to offer them a hope of once again returning to a life in which they were not soldiers, but sons, husbands, and fathers, demanded that treatment of their afflictions had to advance. The introduction and development of psychotherapy, now used widely in the treatment of a multitude of traumas, is their legacy.